Hello and welcome to the HIPAA and Confidentiality module of the training for certification of community-based living arrangements in the state of Nevada. This training and the certification process overall is handled by the Department of Health and Human Services, Bureau of Healthcare Quality and Compliance. The objective of this training module is to provide you with the information about privacy and security rules under HIPAA, which we'll define in a moment, and how this law applies to you and your business of providing community-based living arrangement services. In case you were wondering, to help you remember HIPAA, we have provided you with this lovely picture of a hippo. For those of you who are unfamiliar with HIPAA and its purpose, it is the Health Insurance Portability and Accountability Act of 1996, passed by both houses of Congress and signed by President Bill Clinton. The law's purpose is to protect and enhance people's privacy in regard to their healthcare information, and to assure people's private health information is portable, meaning it can be moved among providers as needed to assure continuity of care. Also, the law sought to reduce overall healthcare costs, improve healthcare quality, improve long-term care access and coverage, combat fraud and abuse, and simplify the administration of health insurance. HIPAA identifies what are called covered entities that must comply with the law. Covered entities include healthcare providers, healthcare clearinghouses, which are businesses that do such things as billing and claims, and health plans. As a community-based living arrangement provider, you are a healthcare provider, and therefore a covered entity that must comply with HIPAA. Healthcare providers are defined as providers of health or medical services and any other person or organization who, in the normal course of business, furnishes, bills, or is paid for care, services, or supplies related to the health of an individual. It is this part of the definition that we have italicized above that brings CBLA providers under the HIPAA requirements. The other defined covered entities that must comply with HIPAA are health plans and healthcare clearinghouses. Health plans are defined as any individual or group plan that provides or pays the cost of medical care. And then healthcare clearinghouses are public or private entities that assist health plans and healthcare providers to standardize their data. Let's define a couple more terms from the HIPAA vocabulary that you'll need to know. Protected health information, referred to as PHI for short, is individually identifiable health information that contains unique features or details by which the individual can be identified. We've discussed some covered entities and what they are, and then disclosure means the release, transfer, provision of, access to, or divulgence of information outside the entity holding the information. The term use means sharing, employment, application, utilization, examination, or analysis of individually identifiable information within an entity. And workforce means employees, volunteers, trainees, and other persons whose conduct in the performance of work is done under the direct control of a covered entity. Next, you'll need to know the HIPAA privacy rule and what it does. The privacy rule defines protected health information. It identifies entities that use and disclose PHI. It mandates rules for the uses and disclosures of PHI. It creates individual rights regarding their PHI, and it requires sanctions for violations of HIPAA. HIPAA privacy rights do not apply to certain information. Psychotherapy notes are not included under HIPAA because they are only disclosed at the discretion of the therapist. All other medical records are to be disclosed and copies given to the client or patient when they request them, but the therapy notes belong to the therapist only. Privacy protection does not extend to information compiled in reasonable anticipation of, or for use in, civil, criminal, or administrative actions or proceedings. And the reference to the Clinical Laboratory Improvements Amendments, or CLIA, is the rule that states the patients have the right to receive their laboratory results directly from the lab, not from the ordering provider, if the patient so chooses. There are some notification requirements you will need to comply with and know about. First of all, you're required to create a notice of privacy practices detailing how you protect your client's health information. As a covered entity, you're required to distribute this notice, and your clients have a right to receive this notice. In addition to distributing the notice of privacy practices to your clients, it must be prominently displayed at your home, such as on a bulletin board in a communal area like the dining room, maybe next to the emergency phone number list. Nevada has adopted a rule that entities covered by HIPAA may use or disclose protected health information for treatment, payment, and healthcare operations only if the individual has signed a prior written consent or gives his or her specific authorization. You'll need to know about the 16 individual identifiers that, when they're connected to health information, create protected health information. Those 16 identifiers are name, postal address other than town or city, state, and zip code, telephone numbers, fax numbers, email addresses, social security number, health plan beneficiary numbers, account numbers, certificate or license numbers, vehicle identifiers and serial numbers, device identifiers and serial numbers, medical record numbers, web universal resource locators, which you might know better as URLs, Internet Protocol address numbers or IP addresses, biometric identifiers such as fingerprints or voice prints, and full-face photographic images or comparable images. There is a principle known as minimum necessary that applies whether someone asks you for information about a client or if you need to ask another covered entity for information. This principle states that when using or requesting PHI from another covered entity, a covered entity must make reasonable efforts and rely on professional judgment to limit the information to the minimum necessary to accomplish the intended purpose of the use, disclosure, or request. When you're applying the minimum necessary principle, we offer the following as guidelines. First, anyone requesting protected health information should have a specific reason for which the PHI is needed. Any disclosure of PHI should be limited to the information that is needed for that specific purpose. If you receive protected health information about a client, its use must be limited to the minimum necessary to perform your job. And then, all this being said, when any release of protected health information is for diagnosis or treatment, anything has the potential to be relevant, and the minimum necessary principle does not apply. As you get ready to incorporate privacy considerations into your policies and procedures, keep in mind that your CBLA clients have a right to file complaints with the Bureau of Healthcare Quality and Compliance about anything related to the services you provide them. This includes complaints about privacy. Any complaints regarding your CBLA privacy policies or compliance with those policies will be forwarded to the state's mental health privacy officer, and the mental health staff that monitors your clients might also investigate the complaint. And regarding your complaint policy, you may never make treatment, payment, or enrollment conditional upon your clients signing away their rights to file a complaint, either with the state or with federal health officials. When it comes to releasing protected health information, you have an obligation to think ahead about possible uses of that information. As a covered entity, you must mitigate as much as you can any known harmful effect that could result from the use or disclosure of PHI in violation of its policies and procedures or the requirements of the rule. Your duty to mitigate applies whether the privacy breach was caused by a member of your staff or by a business associate, as the harm is the same in either case. Not to scare you, but there are some stiff penalties for HIPAA violations. In the wrongful disclosure category, knowingly disclosing health information for improper use or to an unauthorized entity can cost you $50,000 and a year in prison. Obtaining health information under false pretenses can cost $100,000 and 5 years in prison. And selling, transferring, or using health information for a commercial advantage, personal gain, or malicious harm can set you back $250,000 and land you a 10-year engagement behind bars. Let's define a couple more HIPAA terms. First is privacy. Privacy refers to policy to determine what can be disclosed, to whom, and under what circumstances. To maintain privacy, we need security. Security deals with tools and processes to be put in place to ensure privacy in the electronic world. As we just mentioned, security refers to the tools and processes to protect privacy, and security applies to information stored or transmitted electronically. It's divided into three main areas. First, we have administrative safeguards. These are administrative actions and policies or procedures to manage the selection, development, implementation, and maintenance of security measures that protect electronic PHI and that manage the conduct of your workforce in relation to the information. Next is physical safeguards. These are physical measures and policies or procedures to protect a covered entity's electronic information systems, related buildings, and equipment from natural and environmental hazards, such as a flood or fire, and against unauthorized intrusion, such as if someone breaks in and tries to steal your computers. Third, we have technical safeguards. This is technology and policies or procedures for use of and access to protected health information. An example of this would be a password. Here we'll review some basics of a secure information system. First, you want to control access to the system by limiting it to authorized staff. Access can be based on roles within your CBLA, or it can be given only to certain users. Either way, it helps ensure access is kept to a minimum. Passwords are used not just to control access, but also to provide authentication of the user and as a way to audit the access, which means you can track whether or not someone has tried to gain unauthorized access to your client's protected health information. Another element of a secure information system is virus control, since viruses can be either used to destroy information or be used to steal it. You will want to use hardware and software that are approved by an IT specialist, either on your staff or an outside contractor. And finally, you'll want to back up your information so it is duplicated somewhere in case something happens to it. Let's back up for a second and talk about the ways protected health information can be transmitted. For example, it can be physically seen on a computer screen that is left open or on a piece of paper left on a table. It can be communicated verbally in a face-to-face interaction. It can be sent via fax or email. Again, it can be communicated verbally, but over the telephone. And it can be sent physically through the mail. In that vein, here are some tips to minimize visual misuse of protected health information. Be sure to always turn your computer monitors away from the general public. You can also restrict access to areas where PHI is openly displayed. This might mean putting a lock and a sign on a business office you have in your residence or at your CBLA house. You should shred documents before putting them in the trash. If you use medical charts and a chart holder, place them with the name faced inward and away from passing eyes. And always maintain a clean desk policy so that your client's protected health information isn't just sitting out where someone could walk by and see it or take it. Here are some ways to minimize face-to-face misuse of protected health information. You should conduct conversations about clients in areas away from other people. Carry on these conversations in low but clear voices. If you talk about a document, don't show the document to another person if that document contains additional information that is protected and not part of the issue being discussed. And be sure to take inventory of all the documents you have before ending your conversation to make sure nothing is left behind. To help minimize misuse of PHI via fax, you should call the person you're faxing it to so they can be ready to receive it right away. You should also verify that the receiving fax machine is in a secure location. Verify that the destination number before you press send, and after the fax is sent, call the recipient to make sure he or she got it. To avoid misdialing, you can pre-program frequently used numbers into the machine, and when sending the fax, use a cover sheet indicating the sensitive nature of the information, but be sure not to put any sensitive information on the cover sheet. When sending protected health information via email, Verify the email address before you send. Then you confirm with the recipient that the email address is password protected. You can set up your email to notify you when the email containing the PHI has been received and when it's been opened. And be sure to use any available encryption features to add another layer of protection to the PHI you're sending. When you're discussing a client's business over the phone, do not volunteer new information when the caller is only confirming details that he or she already knows. If you receive a call requesting protected health information, write down the organization's name and main number, the caller's name and extension, and then hang up. You can call them back immediately if it's urgent. This enables you to confirm who is making the request. You can also confirm the caller's identity by asking them details about the client they're asking about, such as their date of birth, address, or health plan number. You might remember from your own experience calling a doctor's office that they always ask for your date of birth to protect you, and you can do the same thing to help protect your clients. Finally, when sending protected health information using the good old-fashioned mail, always address confidential material to the named addressee. If you can, use registered mail delivery. Mark the package to show it contains private information. Verify the postal address to which you're sending the PHI, and use tape to seal the package and sign over the tape so that if it's broken, the recipient will see that their information might have been accessed improperly. In addition to privacy protection under HIPAA, your clients have confidentiality rights under another section of federal law. We're referring to Section 42 of the Code of Federal Regulations, also known as CFR, regarding the confidentiality of alcohol and drug abuse patient records. Mental illness can increase a person's risk of alcoholism and substance abuse, which is seen by the prevalence of co-occurring disorders in individuals seeking mental health treatments. As a CBLA provider, your client's information regarding treatment for alcohol and drug abuse should be protected by the confidentiality of alcohol and drug abuse records under 42 CFR, which states that the confidentiality of alcohol and drug abuse patient records maintained by a residential outpatient program is protected by federal law and regulations. Generally, the program may not say to a person outside the program that a patient attends the program or disclose any information identifying a patient as an alcohol or drug abuser. An alcohol and substance abuse program is defined as any person or entity that holds itself out as providing and actually provided alcohol or drug abuse diagnosis, treatment, or referral for treatment. Similar to the rules under HIPAA, disclosure of alcohol and substance abuse medical records is allowed when the patient consents in writing, the disclosure is allowed by a court order, or if the disclosure is made to medical personnel in a medical emergency or to qualified personnel for research, audit, or program evaluation. Any violation of this federal law or the regulation is a crime, and suspected violations may be reported to the appropriate authorities. The federal regulations specify that patients are allowed access to their own records. Part 2.23 of 42 CFR states that patient access is not prohibited. These regulations do not prohibit a program from giving a patient access to his or her own records, including the opportunity to inspect and copy any records that the program maintains about the patient. Your client's medical records that you obtain as a CBLA are your property as the provider, and are maintained for the benefit of the client as a consumer, the medical staff, and the Nevada Division of Public and Behavioral Health. As mentioned earlier in this presentation, patients can make written requests that their protected health information be shared. This is done via an authorization for disclosure of health information form obtained from the Division of Public and Behavioral Health caseworker for the client. The federal regulations specify the information that must be included in the written consent. The specific name or general designation of the program or persons permitted to make the disclosure, the name or title of the individual or the name of the organization to which the disclosure is to be made, the name of the patient, the purpose of the disclosure, and how much and what kind of information is to be disclosed. And take note that the disclosure may not be general in nature. It may not state things such as to whom it may concern. The written information disclosure consent also must contain the patient's signature. If the patient is a minor, the signature of the person authorized to give consent, or if the patient is incompetent or has died, the signature of a person authorized to sign in lieu of the patient under the federal regulation. It also must include the date on which the consent was signed, and be sure the consent includes when the authorization will expire, either a certain number of days from the signing up to 1 year. The disclosure should state that the consent is subject to being revoked at any time, except to the extent that the program or person which is to make the disclosure has already acted in reliance on it, and the date, event, or condition upon which the consent will expire if it is not revoked before that. The date, event, or condition will not last longer than is reasonably necessary to serve the purpose for which the disclosure is given. This group photo of hippos is to remind you that HIPAA works best when we all work together. This is the end of the module about HIPAA and confidentiality in the State of Nevada Community-Based Living Arrangement Certification Training. You can return to the NV eLearn webpage for this module and take the test to evaluate your learning on this subject, and when you pass the test, a certificate of completion will be available for you to print and download.